I've been practicing plastic surgery here in New York City since 1983. My practice is located on the Upper East Side of Manhattan. I do the full gamut of cosmetic surgery from head to toe, but I tend to focus on certain procedures like rhinoplasty, liposuction, breast augmentation, and cellulite reduction. What I am so excited to talk to you about today is Cellulaze, that I've incorporated into my practice this year. In the past, the lotions, the potions, the laser machines, the infrared devices, the suction, the vacuum machines do not work at all on a permanent basis. They are temporary in nature at best, but now we have game-changing technology with Cellulaze, where with a laser fiber, we can directly get to the anatomy and address the problem of cellulite, which is thin skin, bulging fat, and those little bands that pull in and give you that dimpled appearance to the skin. It's minimally invasive, it's an office-based procedure, it's pretty much the convalescence of liposuction like with Smart Lipo, and you wear a garment, you go home, and the recovery is really straightforward, and results will manifest themselves over maybe 3 to 6 months.
I'll start by saying that I've always been an athlete, and regardless of this, I started to notice my cellulite around the time that I was 17 or 18. And since then, I've noticed it's pretty much only gotten worse, and this is despite the fact that I work out on a very regular basis, about 5 times a week. I run, I swim, I lift weights, I also eat a healthy diet. In my experience, I've never noticed that eating right and exercising has had any effect on my cellulite. I've also run the gamut with cellulite treatments from Vela Shape, Smooth Shapes. I've done endermology. I've tried all sorts of different lotions and creams. Nothing has had any more than a temporary effect, which is why when I heard about Cellulaze, I was very excited. As far as I know, it's a one-time treatment, and after reading up on the clinical results and seeing that it was FDA approved, I decided that I wanted to be able to come in and not only do this for me, but being as I'm also an esthetician, have something to recommend to my clients.
Cellulaze can treat what was once considered untreatable. Cellulaze is a unique treatment that uses laser energy to disrupt trapped pockets of fat, release fibrous bands that pull down on the skin, stimulate collagen growth for thicker, more elastic, and healthier looking skin.
Today is the day of my treatment. I'm very excited to see how this goes. I've done enough research to know that Cellulaze and Dr. Diktaban is the right combination for me.
Laser cellulite reduction. Cellulaze reduces the appearance of cellulite in just one treatment. Cellulite isn't a fat problem, it's a structural problem below the skin, and that's not your fault. So why do so many cellulite treatments focus on treating fat from above the skin? Only Cellulaze attacks the brittle structural bonds beneath the skin that are the real cause of cellulite's dimpled appearance. And Cellulaze increases your skin's natural depth for a smoother, healthier look that lasts, all from just one simple treatment. A very small cannula or tube about the size of the tip of a pen is inserted under the skin. The laser fiber inside the tube delivers energy directly under the skin. This increases the depth and quality of your skin while simultaneously releasing the fibrous bands that pull it down, minimizing the orange peel look that is associated with cellulite.
The ideal candidate for Cellulaze is any woman or man, even though it's rare in men, who has cellulite on any part of their body. Most commonly, you're going to see it on the lower buttocks, the back of the thighs, but even circumferentially around the thighs. But wherever you have fat and dimpling, that little laser fiber can get in with a little pinpoint access incision and directly target the area of bulging fat or the little bands that are giving that contraction to cause that dimpling. It's a great device because people who are thin and lean still have cellulite. There's a misconception that overweight people get cellulite, which they do, but thin people, and I've been seeing now with the introduction of Cellulaze, a lot of women who are lean, they're triathlon runners, and they still have cellulite despite being within the body mass index characteristics of a normal person.
Only Cellulaze uses a laser which allows for more precise tissue targeting. Cellulaze is proven to yield consistent results after just one treatment. Cellulaze is the only minimally invasive surgical cellulite treatment to be offered after extensive clinical studies. Safer? Yes. Minimally invasive? Certainly. More effective? Cellulaze has documented proof that just one single treatment results in measurable improvement to cellulite's appearance, improvement that lasts 12 months or more, consistently high levels of patient satisfaction.
My patients have reported back to me that they feel quite comfortable now wearing shorts, bathing suits, and do not feel self-conscious about the cellulite appearance that they once had.
It's been about 3 months since my Cellulaze procedure. I'm really excited about the results. I'm feeling much more confident than I did before. It's the summertime. I'm back in shorts. The treatment itself was a piece of cake. The recovery was about a day of rest, and then I was back at work the following. It was a week until I was in the gym again. The whole thing was a breeze. I'm really thrilled.
If you are interested in learning more about Cellulaze or any other cosmetic procedure, please call my office for a complimentary consultation.